Hey guys, it's Aaron from Vector Health here. Just going to have a bit of a chat today about knee valgus. Basically what that is the knee dropping in sideways. Particularly see it when you do things like squats, lunges, any sort of step-in routine with your legs. So we're going to really talk about sort of causes, problems that can occur as a result of it, and sort of just little things to try and help sort of bring that leg back out of that valgus force, that bowing in. So what is it? As I said before, it's the bowing in of the leg. So if this is the leg here, this would be a right leg. This is the fibula, tibia, femur. What would happen is the leg bows in that way. Okay, so what we want to do is try and get it to come the other way a little bit. So why does it happen? There's a couple of reasons. One, the adductors, the leg on the inside of your groin, they can sometimes be too tight or overactive. On the other end of that, the legs in the top of the hip or the top of the glute, they can be a little bit weak and not sort of pull the leg around and pull it back out of that sort of bowing force. Other things, sort of weak TFL, ITB type thing, and then just some general biomechanics. You can dive into the feet and that sort of thing, but typically it is usually around that sort of hip area. What do we do to sort of fix that? Well, one is getting the glutes nice and strong, but it's not the big glute muscles, it's not your squat muscles, it's your clams, it's your crab walks, it's side kicks, all those sort of things where the whole leg has to move to the side and back in. So you should be feeling it up in that hip. Other things as well, you want to be stretching the inside of your leg and your hips there. So, standing up, hips rocking side to side, even getting some circles, that sort of thing, just to get things freed up and moving a little bit better. So what can happen if you're not sort of trying to work on the tight muscles or increase the strength in the weaker ones? What can happen is, as that leg drops in, you're going to be stretching those inside ligaments. You can also get the ACL going, which is this guy in here, right in the middle of the joint. So what will happen is you stretch there, you can get a bit of a twist force in it as well. And those two in particular are really big contributors to meniscus and ACL injuries. So they're probably one of the bigger reasons why you want to do it. You will also compress the lateral meniscus part as well. You'll get some jamming up, get some sort of outside knee pain, maybe some ITB tightness, little things like that as well. Which typically, a little bit easier to work out as opposed to a meniscus or a ligament injury. But all in all the same, still important to get on top of it and not let your knee drop in during your squats, your impact controls in particular as well, particularly boys in footy and girls in netball. You want to be able to plant that leg down, be strong on that plant, and be able to push off and not have that knee sort of wobble around too much. It will a little bit, and that's normal, but it's how much and how you control it as well. So if you're struggling with something like this, you're getting a little bit of knee pain or anything like that, come on in, we'll have a little bit of a chat, we'll see what's going on, and we'll get you back on the road.